Most women miss this number one fertile sign. Don't be one of them. If you're trying to get pregnant, there's one sign that your body gives that is more powerful than most apps, calendars, or even some ovulation kits. But most women completely ignore it. They completely overlook it. In this video, I'm going to show you what that sign is, why it matters, and exactly how to recognize it so you never miss your fertile window again. Let's get straight into it. Most overlooked fertile sign is your cervical mucus. Yep, your vaginal discharge. Now, before you scroll away, hear this. Cervical mucus is not just random wetness or something to clean up. It's your body's natural fertility tracker. It tells you what your hormones are doing and whether your body is ready to conceive. No expensive device required. How it works is that your cervix, the lower part of your uterus, produces mucus throughout your cycle. And this mucus changes in texture, amount, and appearance depending on where you are in your cycle. But the type that matters most is called that egg white cervical mucus. It usually shows up a few days before ovulation. It looks just like raw egg whites. It's clear, it's stretchy, it's slippery. When you see this, your body is saying, now is the time. Why is this mucus so important? Because it does three important things. One, it protects sperm from the natural acidity of the vagina. Two, it helps the sperm swim up into the uterus and towards the egg. And three, it actually nourishes the sperm, helping them survive longer, up to 5 days. That means even if you have sex before you ovulate, the sperm can stay alive in that mucus, just waiting for the egg to drop. No mucus, no protection, no nourishment, less chance of conception. That's why ignoring this sign is a huge missed opportunity. Let me break it down into 4 stages of cervical mucus so that you can confidently recognize what to look for and when. This is one of the most powerful signs your body gives you about where you are in your cycle, and it can tell you exactly when you're fertile if you know how to read it. So stage 1, right after your period. This is the dry phase. Right after your period ends, it's normal to feel like there's nothing going on down there. You might feel dry, or maybe there's just a hint of moisture, but generally there's little to no mucus. At this point, your body hasn't started ramping up estrogen. That's the hormone that drives fertile mucus production. So while the bleeding is over, this is not a fertile time. Stage 2 is a few days later. The mucus becomes sticky or creamy mucus. As your estrogen levels begin to rise, your cervix starts producing more mucus. You might notice it's sticky, pasty, or creamy, just like lotion, or even a little tacky to the touch. So this type of mucus is not yet fertile, but it means your body is gearing up for ovulation. It's a transition phase, kind of like a yellow light before the green light. The sperm won't swim very well in this kind of mucus, but we are getting close. Stage 3, approaching ovulation. Your mucus becomes watery. Now things start to shift. Your mucus becomes more watery, wetter, and more abundant. You might feel a little bit of dampness in your underwear, or notice that it's easier for fingers to glide during checks. This watery consistency helps sperm begin to move more easily, but this still isn't the peak. Your body is getting ready to release an egg, and this is the lead up to that point. Pay close attention during this time. Stage 4, peak fertility. The egg white mucus. This is the main event. You will know it when you see it. The mucus is clear, it's stretchy, it's slippery, just like raw egg whites. You should be able to stretch it between your fingers without breaking. This is your body's green light. Egg white cervical mucus is designed to help sperm survive and swim efficiently through the cervix and towards the egg. It's the most sperm-friendly environment your body can create, and it's your cue that ovulation is either happening right now or about to happen. Tracking your cervical mucus every day gives you real-time insight into your cycle, something that no app can match. And if your mucus isn't following this pattern, that can also be a clue that something is off hormonally and worth looking into. So once you notice that egg white cervical mucus, aim to have sex that day and the next 2 days if possible. That's your most fertile window. Now here's the part most people don't tell you. You don't need to insert your finger or do anything complicated. You can just observe the mucus on your underwears, on toilet paper, like after wiping, or just by paying attention when you go to the bathroom. But consistency matters. Start tracking every day after your period ends. Just make a mental note of what you see, what you feel, and after a couple cycles, you'll start recognizing your body's pattern, and that alone can increase your chances of pregnancy dramatically. Now let's talk about what can interfere with cervical mucus, because some women don't see much of it, and there's usually a reason. Number one, dehydration. If you're not drinking enough water, your body has less fluid to produce quality mucus. Aim for at least 2 liters per day. 2, antihistamines or cold medications. These dry out all your mucous membranes, including your cervix. If you're actively trying to conceive, avoid these during your fertile window if possible. The third one is hormonal imbalances. Conditions like PCOS, polycystic ovarian syndrome, thyroid dysfunction, or high prolactin levels can reduce the quality or the amount of fertile mucus. The fourth one is your age. Cervical mucus naturally declines with age, especially after 35 years old. This is one reason it can take longer to conceive as you get older. The fifth is smoking. Smoking can damage the cervix and decrease fertile mucus production. So what can you do if you're not seeing that egg white cervical mucus? There are a few simple strategies. Stay hydrated. Drink water consistently. Some people also benefit from fertility-friendly lubricants like Pre-Seed. This does not replace your mucus, but they mimic its properties and they don't harm the sperm the way regular lubricants might harm the sperm. And of course, treat any underlying medical condition. If your cycles are irregular or your mucus never shows that fertile pattern, don't guess. It's time to get evaluated. Let me be clear. Your cervical mucus is not dirty. It's not weird. It's one of the most intelligent bioindicator systems built into your body. And when you learn to understand it, you gain serious advantage. So to recap the key points, egg white cervical mucus is the strongest natural signal that your body is ovulating soon. It's clear, it's stretchy, it's slippery, just like raw egg whites. It helps sperm survive and reach the egg, increasing your chances dramatically of getting pregnant. Start tracking it every day after your period and time intercourse when it appears. Drink water, avoid medications that dry you out, and treat any hormonal imbalances to support healthy mucus. You don't need a lab. You don't need an expensive app. You just need to pay attention to your body because it's already talking to you. If this helped you, let me know in the comment section below. And if you've never tracked your mucus before, I challenge you to try it this cycle. You might be surprised by what you learn. Thanks for watching and see you in my next video.